trying to figure out how to deal. And so I wanted to get you a sneak peek at this workbook so that you could practice dealing. Hello, hello, my shadowy friend. Just things to help you practice dealing. Okay. So, chapter 1, or exercise 1, helps you to understand your pain. And it's important to understand, right? Acute versus chronic pain. Chronic pain is the kind of pain I have that's like almost all the time. Acute pain is short-lived. It's like if you twist your ankle or something like that. That's usually a symptom of a underlying problem. Sometimes chronic pain, and so this book acts kind of like chronic pain isn't necessarily a symptom of an underlying problem. I would correct it and say chronic pain is often a symptom of a problem that needs to be solved by looking at, like the nerves themselves or the brain. Sometimes, like in fibromyalgia, well, that science may be different too. Sometimes you may feel like physicians have acted like your chronic pain means there's nothing wrong with you and you don't have an underlying problem. And well, it's because there isn't something they can like just fix or set, like a broken bone or something. It's this thing that's not going to kill you. It's not going to cause you morbidity or mortality in the moment. It just makes you miserable, right? And so sometimes we can be made to feel like we are nuisances. You shouldn't be made to feel like you are a nuisance because of your chronic pain. Because chronic pain can be a symptom of weight that's too much for your bones, certain diets and so forth that are hurting and causing inflammation in your body, nerve endings that are too sensitive because of trauma. Right? A lot of people with fibromyalgia, like I have, also have, in fact, 90% of combat veterans, 90% of men with fibromyalgia are also combat veterans. Right? So there's something else that was thrown out of whack by chemicals you were exposed to, or by a blast that you were exposed to, something that happened. You've got some stuff in your hair here, something that happened that caused you to have a change in how your body processes pain, right? People who have TBIs have different pain, right? The way your body processes pain has been changed in some way, and now it processes pain even when there isn't an immediate danger, right? Just like how in PTSD, people have panic even when there's not an immediate reason to have a fight or flight reflex, right? Or freeze. It's also a reflex that people have. It's also freeze. So, it's important to understand these things about pain. The reason that it is valuable to understand the difference between acute and chronic pain is sometimes we hurt ourselves more by consistently and always looking for the source of the pain and obsessing over it rather than living our lives. We let it run our lives, right? And that is a huge bummer. That is no bueno. It's just a huge, huge bummer. So why do I say this? I say this because one thing that's very helpful for chronic pain is a technique called radical acceptance. It's where I recognize I have this pain in this moment. Resting isn't going to make it go away, or a lot of times you do need to rest, but you can't let your pain make you be bedbound, right? We have to still be able to do something. So little bits of movement, little bits of exercise, little bits of doing everything you need to do within what you're able to do, body's able to handle. What I'm saying is, if I can accept, let me put this in terms of my own story. So, when I got out of the hospital, and later on, as after I had my, huge health crisis in Korea, right? One of the things I've been working on has been still recognizing that, okay, I have this pain, and I have two options. Three options. One, I can die, and then all my skills disappear, and any benefit that I could have been to other people. Two, I can, refuse to do anything until a solution is found. Or three, while I'm looking for a solution, I can continue to go out and do things and not let my pain control whether or not I'm able to do something, right? And there has to be a balance there. You have to be realistic. And I struggle a lot with this balance because there are days that I'm like this week, I overdid it. I thought that I could go, Sunday, Monday, Tuesday, and Wednesday just doing things nonstop. And so then most of today I've had to lie in bed, not do anything because my body won't. So I could save up energy for you guys for the stream today. And I'm still in a lot of pain, so I won't be able to stream so long because I'm going to need to lie down. Because then I'm not going to be functional tomorrow if I don't also rest, right? I have to have function. So that's on the one end. But on the other hand, I can let my pain make it that I don't do anything at all, and then I don't accomplish anything, and then I might as well be dead, right? And certain medications can make that worse, like opioids. So, radical acceptance is a practice by which we recognize this terrible thing happened. I'm living with the consequences of this terrible thing that happened, this change in my body. It is what happened, and that's it. I can't unmake it happen. This is a thing for assault victims. You can't undo the assault. This is what happened. That is what happened in the course of history and in the way history was written. It is what had to happen. It should not have happened, but this is what happened. Some radical acceptance statements will be ones that I disagree with, like what happened was good, and I think you should never have to say that about something really horrific that's happened to you. But accepting that that is what is, and I can't change it. It is back then. The pain that I have right now, I can't change at this moment with this or this thing. You can't just keep popping pills to make it go away, because there are consequences to that. So instead, accept the level that I have and try to be functional to the best of my ability, right? And the first step of that function is this radical acceptance piece, this understanding that what happened happened. Now what's next is what I need to do next. What are my goals? And that's part of ACT, which is an action therapy, which I haven't had a lot of, but it's a therapy that focuses a lot on planning your next step and taking it, right? So, and that's hard because you have to balance it, right? You have to be realistic with what your abilities are. If you have severe agoraphobia, you're not going to just one day all of a sudden, it's not like a movie where you're suddenly going to be cured and walk out and go into a big crowd. You could put yourself in danger, because if you're in a dangerous situation where you can't make good decisions, that's why for someone like me, because of the healthcare-induced PTSD and the chronic pain, which can affect my thinking, I have to be very astute for what days it's like, I can't be making decisions over other people's lives today, right? I need to be not, because that's not fair to them. But at the same time, you have to go out and do things, or your talents get buried in the ground and are meaningless, right? So that's the difficulty, right? So that's what we're talking about. And when you look at this workbook chapter that I've given you, what they're trying to get at, because where the evidence is right now, is that you can manage pain in an addiction-free way if you can get your head through an idea where your pain doesn't get to control you, you don't overdo things, but you find other ways to treat the pain. You use medication as necessary, but not addictive medication. You try different things. And it kind of, a lot of pain psychology is this aspect of learning to kind of control some of your pain through here. I was always annoyed that I had one pain psychologist who I really didn't like, who made it act like my pain was my fault. Because he was like talking about how, you know, people who have extreme theta waves, like the monks that do certain meditation, well, theta waves can cancel out pain, so you could theoretically meditate away your pain. And it's like, that's great, but there's something wrong with my body. Like, it's just not in my head, right? All pain is technically in your head. Your ankle pain is technically also in your head, right? So it's very unfair that patients with chronic pain have to be made to act like we can just, and it's gone. And people who don't have it don't understand that it's like, what if you were on fire just a little bit every single day, right? Or what if I took, you know, what if I had the technology that I could just do a tiny little cut on your arm and it stings, but it's not going to kill you in any way, and I took care of it every day, so I made sure it wasn't infected. But every day I cut in that same cut over and over again, every day, once a day. So as it was getting better, I just come back and cut again, and I clean it, take care of it. So it's never going to hurt you, it's never going to mess with your function, it doesn't limit your movement, but I'll just come back along and cut you again. That would make you crazy, okay? So anybody with chronic pain, it's not fair when people act like your pain isn't meaningful just because it's not going to kill you, right? Because it can make you pretty crazy. I mean, Chinese water torture, which I don't even know if it was a real thing, but the little drip on your forehead over and over again, that doesn't kill you, it still make you crazy, right? And that can kill you. Sanity is a stat that matters. So, the point of pain psychology is to try to find exercises so that you can diminish as much of this portion of your pain as you can. And one thing that this chapter will talk about that I think you should look through is, when you describe your pain, how do you describe it? Do you describe it in terms of aching? Like, these are two different terms, right? My pain is discouraging, it's aching, it's exhausting, it's wearying, and sometimes it's burning, sometimes it's these little sharp pieces. So half of those words are words that come from my peripheral nervous system, right? The burning quality, or the aching, or the stabbing, those are predominantly, the peripheral component of my nerves telling my brain there's something wrong. My brain, though, also releases a certain amount of pain hormone, right? Substance P goes into your spinal fluid and everything. My brain is part of that too, and that's where the words like wearying come from. Exhausting, that could also be from my peripheral nervous system, or a little bit of both, but discouraging, right? The emotional labels that get added to pain. That's where pain psychology comes in. Like, if I could say that like 50% of my pain comes from the chemicals up in here, and 50% comes from whatever's going on out here that they haven't really understood in fibromyalgia yet, right? If I could say it's 50-50, and I'm in the process, right, where for a while I'd given up on continuing to seek out help for my pain, because I had tried everything that pain management had to offer, and now, tomorrow, I'm actually going to the doctor again to try to get rheumatology and neurology referrals, because I do have some symptoms that maybe they can start digging again.
So I'm going to keep digging at it. And so I would encourage you, don't let them write you off just because you have chronic pain. Make sure they've given you an answer for why you have that pain, right? And possible solutions, or at least amelioration. And if they haven't given you that answer, chip away at it a little bit at a time. But don't make that your obsession. Don't be like, I'm gonna wait to live my life until I have this answer, because you may not get that answer. Modern medical science may still be behind where you need to be. So don't wait to live your life until you're better, right? Live your life while you're sick and miserable. And you may find, like I have, that I have accomplished more in some of these years being sick and miserable than in many of my healthy years beforehand, right? So, look at yourself, look at your body, and see what parts of your pain you can diminish from up in here by getting rid of some of those extra words and labels. So that's where it starts. It starts with like understanding your pain, right? Understanding your whole biopsychosocial experience, right? And they have a good paragraph here, right? You hurt physically, you psychologically respond to the pain. You think about the pain, try to figure out what's causing it. And thinking about it more can sometimes make it worse. I found that I can't keep a pain journal. That's not helpful to me because that causes me to pay attention to it. Whereas endless white distraction techniques from DBT are more helpful for me than mindfulness techniques, because mindfulness techniques cause me to pay attention to what is happening right now, and that causes me to pay attention to this pain. Whereas if I can distract myself, I can get my brain, get different synapses firing, then there's not enough energy for it, because there's a limited amount of ATP, energy floating around your body. Your brain uses something insane, like 2/3 of the energy stores of your body are used by your brain. Your brain is crazy. Something like ridiculous. Actually, it might be at 1/3, but either way, it's an enormous amount of energy that's just used by your brain. And nerves only so much food. So food goes to the nerves that are being used the most. Nerves that are being used less get less, right? So I can give my pain nerves less by giving more to something else at a scientific level, right? But sometimes your pain is so much that you can't like think it away. That's not the thing. But trying to cause yourself to survive it. That's why in the previous video that I talked about pain psychology, I talked about techniques that have been used by prisoners of war to survive torture, right? Envisioning the thing that you care about. This is where we get into Viktor Frankl's logotherapy aspect, right? I think it was Nietzsche who said he who has a firm why can survive almost any how or what, something like that. But if you know why you're suffering and what you're suffering for and what your next step is, it can help you to have that crystal clear focus even when your pain is terrible. And I have days when all I can do is lie there and just try to focus on living through the next moment, because it feels like I am boiling from the inside and something is dissolving me in acid, and it's a very purifying pain. But it's just that I can't, there's just nothing else in the world at that moment but pain and exhaustion and rolling around in delirium and just wanting God to be there, and can't even really think about anything. Certainly not thinking about the Most High in any kind of great way. It's more like maybe He's there. Like if you know someone's sitting next to you and you can't think too much about why they're not fixing it, because you can't think at all, because your whole brain is pain, and you just have to think about the next moment and surviving the next moment and waiting and sweating it out, and eventually 12 hours later it's over, right? It's always going to be over eventually. Your tormentors do not have the energy to keep up forever, right? So that's what I mean for you when I'm talking to you about, yeah, it sucks, and it sucks for some of us how as we get older, our health is just going to get worse. But that doesn't mean that what we do has to get any worse. And it doesn't mean that we have to lose. Even if you grab just a tiny bit of function, help anybody, then you're staying alive just to find that little bit of the Most High that you can. But you can always help somebody. There are people who've been paralyzed from the neck down and are still able to help people. So that's where we get into purpose. So purpose, radical acceptance from dialectical behavioral therapy, ACT therapy, action, like committing to action, and from DBT specifically distraction techniques, or from the kind of visualization techniques of visualizing the thing you care about and kind of making yourself be somewhere else. And that's a meditation technique. That's where you're firing up your theta waves so that you're accessing something. You're somewhere else. You're just not here right now. It's almost like forcible dissociation. And one problem with veterans is sometimes they will have gotten into a habit of dissociation and then they have to get out of that for the PTSD so they don't dissociate in situations where they need to be functional. But during a moment of pain, dissociating, right? So I think this handout will help you, and I just wanted to give you that overview of pain psychology and pain techniques before you dive into it and before you start to really analyzing your pain structure. I heard you beep. So here we go. Chinese water torture. Not related to being waterboarded, that's a different thing. Since you're curious about it. Being waterboarded, they put like a cloth over your mouth and pour water over, and so it feels like you're drowning, but you're not. And it can cause you to have a lot of inflammation up in the sinus passages. You technically won't drown, although you could do it wrong and you could drown yourself. But you can cause even blood vessels in your nose to burst. And that can be a problem. It is possible to asphyxiate on blood. That's why when you get a nosebleed, you're not supposed to tilt your head back. You're supposed to tilt your head forward. So I share your strangely and possibly unhealthily. Before I had chronic pain, I was fascinated with how much pain I could take, and I had at that time a very high pain tolerance. I did, it was something I prided myself in martial arts, and so I also wanted to do like seer school, or I wanted to try waterboarding and see if it was, but I cannot say that would be a safe or healthy idea. There is risk associated, even though it won't kill you. The inflammation, it is still possible to really hurt yourself. So, in extreme examples. So, Chinese water torture is different. You can't move, and there's just one drop of water randomly comes to your head at different times until you feel like it's boring a hole in your forehead, even though it's not. So I was merely mentioning it as an example. People really do terrible things to each other, but as an example of it is possible to have non-lethal pain that can still break you or very much harm you, or even something that's not pain that can harm you. So your feelings do matter, because your feelings are the thing that can seriously impact your behavior and your success. But I hope you'll try this thing. There's a questionnaire on page 12. It's like I would ask you, is your pain aching, throbbing, or pulsing? Is it irritating, nagging, disturbing? Is it splitting, piercing, pounding? And that's where you go through these words that we're talking about. And they split it between biological and psychological emotional pain symptoms. I do want to correct them and say, everything is biological. You are a glorious bag of chemicals. So all of your emotional pain is also biological. It's like increased substance P or different electricity in your brain going to different things. But what they mean biological, they mean like, is a bone broken? Is a, is a blood vessel burst? Is your gallbladder got an infection, right? They mean really infectious or inflammatory or really traumatic in the terms of like physical trauma. By which, when we talk about physical trauma, we talk about like something got whacked. That's what we mean. So that's what they mean by biological. They mean like something that a doctor could like give you a pill for or wrap you up for, like to kill an invading outside force on your body that is somehow hurting you from the outside. Like, something from the outside broke your bone or some bacteria got in your gallbladder and so on. You understand? So all pain is technically biological, but it is different. And they make a really good point in talking about anticipatory pain. And anticipatory pain is the pain we want to get rid of. That's the pain that causes to make the rest of the pain worse. It's like, the pain is awful or I can't handle it, right? So thinking I can't handle it, I end up devoting more ATP, more glucose towards that pain, giving it more resources than it needs. And then I really can't handle it, then it gets worse, right? Because I'm shifting around my biological resources. So you can't control all your pain necessarily. I don't agree with the pain psychologist. You can just meditate on it. And I don't want to say never. I don't want to say anything's impossible. Maybe you can. But I don't want you to beat yourself up or guilt yourself if you can't run a marathon or like brain think your pain away. Instead, I want you to focus on little by little getting rid of the part you can get rid of. Little by little. With the biological portion, you keep going to the doctor little by little. Keep checking a new thing. Keep investigating a new thing. Or if you have a health research coach like me, like find a new study, try the next thing, right? Which that's Jen by Finelli.com. I'm only taking some people that I think I can help out. It's a pay what you want thing. But it's where I research your stuff that you're dead end on. And we try to find things that we can present to your physician, to try your research coach, basically, or things that you can try in your own personal life. But so however you do it, like keep chipping away at the biological, but then you yourself chip away at the psychological, right? Which again, like I said, is also biological, right? But you know what I mean? That other section of your pain. Chip away at it. And if you know, even if you don't have chronic pain, knowing these techniques can help you to survive other pain, like acute pain or torture pain or things like that. Like some of these techniques have been used by torture survivors, right? So being able to think of what you need to do in the moment and not cans or can'ts. Just, okay, what's the next thing I can do? What's the next little bit of psychological pain I can take away? So, and they split the ascending right from up here signals. And I think ascending and descending, the other way around, ascending coming up and descending coming down, and they spelled descending wrong. But I think that's a better way to say it than psychological or ascending, or psychological or biological. What comes from your peripheral system or what comes from your central system. So I hope that you will take a look at that. We might do more at another day, but I think that's a good start. So I want you to sit down and try that first exercise and think about how you characterize your pain some of these messages, right? If you have these thoughts like, I can't handle it, or it's awful, and it may well be awful, but if you can stop repeating that to yourself and repeat a different thing instead, you can take those ATP resources away from the pain, right? So write down things you could repeat instead. Write down what the thoughts are that you have that have these descending attributes, and see if you can replace those thoughts with other thoughts. And in that way, start little by little. Even if it's just tomorrow, every time I think my pain is awful, I am going to distract myself with this activity. Or every time I think my pain is awful, I'm going to tell myself, I am handling this so that I can accomplish my mission, right? Or I can do it, or whatever it is. Whether you use a replacement thought, or whether you use a distracting activity, or whether you start visualizing something you care about, or giving yourself physical pleasure in some other way, right? So those, because your nerves can only carry so many sensations at once, so you can replace some of those sensations with pleasure sensations. That can be a way to self-soothe on the psychological level. So I hope you'll go back when I post this, watch this again, for those of you who have chronic pain, or those of you who have family members with chronic pain, and think about things you could try. I hope that's helpful. Try just one